Question 1. Performance analysis shows that patient with a history of essential hypertension, well managed prior to pregnancy, presented for labor and delivery. During labor, her blood pressure significantly elevated, requiring intervention and close monitoring, ultimately leading to a vaginal delivery. The physician's documentation clearly indicates that the pre-existing hypertension was a primary consideration throughout the labor and delivery process, influencing management decisions. Which coding approach best represents this clinical scenario according to ICD 10-cm guidelines for pregnancy, childbirth, and the puerperium? Option A. Code essential hypertension as the principal diagnosis, followed by a code for uncomplicated vaginal delivery. Option B. Code the encounter during childbirth as the principal diagnosis, with essential hypertension as a secondary diagnosis. Option C. Code the essential hypertension complicating pregnancy as the principal diagnosis, followed by the code for the encounter during childbirth. Option D. Code only the encounter during childbirth, as the hypertension was pre-existing and managed. The correct answer is C. Code the essential hypertension complicating pregnancy as the principal diagnosis, followed by the code for the encounter during childbirth. Explanation. Scenario analysis. This scenario presents a common challenge in coding for pregnancy, childbirth, and the puerperium, accurately reflecting the patient's condition and the services provided when complications arise. The challenge lies in the sequential nature of coding these conditions, the need to identify the principal diagnosis, and the correct application of ICD 10-cm codes to capture the full clinical picture, including both the pregnancy-related condition and any coexisting non-pregnancy-related conditions that influenced care. Misinterpretation can lead to inaccurate reimbursement, incomplete patient records, and potential compliance issues. Correct approach analysis. The correct approach involves identifying the principal diagnosis as the condition chiefly responsible for the admission or encounter. In this case, the pre-existing hypertension that required management during pregnancy and labor is the primary reason for the encounter's complexity and the focus of the physician's attention. Coding this with the appropriate ICD 10-cm code for essential hypertension complicating pregnancy, followed by the code for the encounter during childbirth, accurately reflects the clinical reality and adheres to coding guidelines for pregnancy and childbirth. This ensures that the patient's history and the impact of the chronic condition on the current obstetric episode are properly documented and reimbursed. Incorrect approaches analysis. An approach that prioritizes the childbirth encounter code without adequately reflecting the complicating hypertension fails to capture the full clinical picture and the impact of the pre-existing condition on the management of labor and delivery. This is a regulatory failure, as it does not fully represent the patient's condition, as required by ICD 10-cm guidelines for pregnancy complications. An approach that codes the hypertension as a secondary diagnosis without establishing it as the principal reason for the encounter, or without linking it appropriately to the pregnancy, misrepresents the clinical significance of the condition during the obstetric episode. This can lead to underreporting of the complexity of care and potential issues with quality metrics or risk adjustment. An approach that uses a code for uncomplicated childbirth without acknowledging the complicating hypertension is a direct violation of ICD 10-cm guidelines, which mandate the reporting of all conditions that affect patient care. This is a significant compliance failure and misrepresents the patient's health status. Professional reasoning. Professionals should approach coding for pregnancy, childbirth, and the puerperium by first reviewing the entire medical record to understand the patient's history, the reason for admission, and all conditions managed during the encounter. They must then consult the ICD 10-cm official guidelines for coding and reporting, specifically the sections pertaining to pregnancy, childbirth, and the puerperium, as well as guidelines for sequencing principal and secondary diagnoses. The focus should always be on accurately reflecting the clinical documentation and the patient's condition according to established coding standards. Question 2. Quality control measures reveal a discrepancy in coding for a patient presenting with persistent feelings of sadness, loss of interest in activities, and significant fatigue, for which the physician documented a diagnosis of major depressive disorder, single episode, moderate. However, the coder initially assigned a code for fatigue and another code for depressed mood. Which of the following coding approaches best reflects accurate ICD 10-cm coding principles for this scenario? Option A. Assign the ICD 10-cm code for major depressive disorder, Single episode, moderate, as the symptoms of fatigue and depressed mood are integral components of this diagnosis, and the physician's documentation specifies the definitive diagnosis. Option B. Assign ICD-10-CM codes for fatigue and depressed mood separately, as these are distinct symptoms reported by the patient, and the physician's note also mentions these specific complaints. Option C. Assign the ICD-10-CM code for depressed mood and a code for loss of interest, as these are the most prominent subjective complaints documented by the patient. Option D. Assign the ICD-10-CM code for fatigue and query the physician to determine if depressed mood is a separate condition or part of the major depressive disorder. The correct answer is A. Assign the ICD-10-CM code for major depressive disorder, single episode, moderate, as the symptoms of fatigue and depressed mood are integral components of this diagnosis, and the physician's documentation specifies the definitive diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge in mental health coding, where a patient exhibits symptoms that could align with multiple diagnostic categories. The professional coder must navigate the nuances of ICD-10-CM, assuming U.S. jurisdiction for this exam, to accurately reflect the patient's condition based on the provided clinical documentation. The challenge lies in distinguishing between primary diagnoses, secondary conditions, and symptoms that are integral to a more specific diagnosis, ensuring that the coding reflects the most accurate and complete picture of the patient's health status for billing and statistical purposes. Correct approach analysis. The correct approach involves a thorough review of the entire clinical encounter note, paying close attention to the physician's diagnostic reasoning and the specific criteria met for each potential diagnosis. This includes identifying if a symptom is a manifestation of a more definitive diagnosis, or if it represents a separate, distinct condition. In the context of ICD-10-CM, this means prioritizing definitive diagnoses over symptomatic codes when the symptom is inherent to the definitive diagnosis. For example, if a patient presents with anxiety and is diagnosed with a specific phobia, coding only for anxiety would be incomplete and potentially inaccurate. The correct approach would be to code the specific phobia, as anxiety is a core component of that diagnosis. This aligns with the ICD-10-CM official guidelines for coding and reporting, which emphasize coding to the highest level of specificity documented. Incorrect approach is analysis. One incorrect approach would be to code only the most prominent symptom without considering the physician's overall diagnosis. This fails to capture the full clinical picture and may lead to undercoding or misrepresenting the patient's condition. Ethically and regulatorily, this is problematic as it does not adhere to the principle of coding to the highest specificity documented, potentially impacting reimbursement and public health data. Another incorrect approach would be to code multiple diagnoses without clear documentation supporting each as a distinct and separate condition. This could involve coding both a general symptom and a specific diagnosis, where the symptom is already encompassed within the specific diagnosis. This violates the principle of avoiding redundancy in coding and can lead to inflated billing and inaccurate statistical reporting. It also fails to demonstrate a clear understanding of diagnostic hierarchies within ICD-10-CM. A third incorrect approach might be to select a diagnosis based on a patient's self-report of symptoms without corroboration or a definitive physician assessment. While patient reports are crucial, the final diagnosis for coding purposes must be established by the healthcare provider. Coding based solely on patient statements without physician confirmation is a regulatory failure and an ethical breach, as it bypasses the established medical diagnostic process. Professional reasoning. Professionals should approach such scenarios by first understanding the physician's diagnostic statement. They should then cross-reference this with the ICD-10-CM coding manual, paying attention to inclusion and exclusion notes and the hierarchy of codes. When faced with multiple potential codes, the coder must review the entire medical record for documentation that supports one diagnosis over another or clarifies the relationship between symptoms and diagnoses. If documentation is ambiguous, the coder should query the physician for clarification to ensure accurate and compliant coding. This systematic approach ensures adherence to regulatory requirements and ethical coding practices. Question 3. Analysis of patient presenting to the emergency department with a fractured tibia sustained after tripping over a rug in their home. The physician's documentation notes fracture of tibia, right, due to fall at home. The coder needs to assign appropriate ICD 10cm codes to fully capture the encounter. Which of the following coding approaches best reflects the regulatory framework for external causes of injury? Option A. Assign a code for the tibia fracture and a code for fall on and from unspecified stairs and steps as the external cause. Option B. Assign a code for the tibia fracture and a code for fall on and from stairs and steps as the external cause. Option C. Assign a code for the tibia fracture and a code for fall on and from rug as the external cause. Option D. Assign a code for the tibia fracture and omit external cause codes as they are not always mandatory for reimbursement. Correct answer is B. Assign a code for the tibia fracture and a code for fall on and from stairs and steps as the external cause. Explanation. This scenario is professionally challenging because accurately capturing the external cause of an injury requires meticulous attention to detail and a thorough understanding of coding guidelines, particularly when multiple contributing factors are present. The coder must discern the primary event and its circumstances to ensure the patient's record reflects the complete picture of how the injury occurred, which is crucial for accurate data analysis, public health reporting, and appropriate reimbursement. The correct approach represents best professional practice because it adheres strictly to ICD 10cm official guidelines for coding and reporting, specifically the sections pertaining to external causes of morbidity and mortality, Chapter 20. This involves identifying the principal diagnosis and then assigning the appropriate external cause codes from categories V00Y99 to describe the circumstances of the injury. This ensures that the coding is complete, accurate, and compliant with regulatory requirements for reporting injury data. An incorrect approach that fails to identify the specific mechanism of the fall, e.g., slipping on ice, and instead only codes the general category of fall, is a regulatory failure. This is because the ICD 10cm guidelines emphasize specificity. The external cause codes are designed to provide detailed information about how an injury occurred, and a less specific code fails to meet this requirement, potentially hindering accurate data analysis and research. Another incorrect approach would be to omit external cause codes altogether when the documentation clearly indicates an injury. This is an ethical and regulatory failure, as it violates the principle of complete and accurate coding. External cause codes are not always mandatory for reimbursement, but are essential for comprehensive health data collection and understanding injury patterns. A further incorrect approach might be to assign an external cause code that does not accurately reflect the documented circumstances, such as misinterpreting the intent of the activity leading to the injury. This is a significant ethical and professional failure, as it misrepresents the patient's experience and can lead to flawed data and potentially inappropriate interventions or policy decisions based on that data. Professionals should employ a decision-making process that begins with a thorough review of the entire medical record, including physician notes, nursing documentation, and any incident reports. They must then consult the ICD 10cm official guidelines for coding and reporting, paying close attention to the instructions for coding external causes. When faced with ambiguity, they should query the physician for clarification to ensure the most accurate and specific codes are assigned, thereby upholding professional integrity and regulatory compliance. Question 4. The control framework reveals that accurate ICD 10cm code assignment is paramount for proper healthcare reimbursement and statistical analysis. When faced with a patient diagnosed with acute exacerbation of chronic obstructive pulmonary disease, which of the following approaches best demonstrates adherence to the ICD 10cm chapter breakdown and coding principles? Option A. Locate chronic obstructive pulmonary disease in the alphabetic index, identify the primary code for COPT, and then search for a specific code for exacerbation within the same chapter or a related chapter as indicated by instructional notes. Option B. Assign a code from the chapter pertaining to respiratory infections, as exacerbations are often triggered by such events. Option C. Directly assign a code for acute exacerbation without first identifying the underlying chronic condition in the index. Option D. Select a code based on the patient's symptoms, such as shortness of breath, without referencing the underlying chronic condition. Correct answer is A. Locate chronic obstructive pulmonary disease in the alphabetic index, identify the primary code for COPT, and then search for a specific code for exacerbation within the same chapter or a related chapter as indicated by instructional notes. Explanation. Scenario analysis. This scenario is professionally challenging because accurately assigning ICD-10-CM codes requires a thorough understanding of the disease classification system and its hierarchical structure. Misinterpreting the chapter breakdown can lead to incorrect coding, impacting patient records, billing accuracy, and statistical reporting. The complexity arises from the need to differentiate between closely related conditions that may fall into different chapters or subchapters, demanding careful review of the medical documentation and the ICD-10-CM official guidelines for coding and reporting. Correct approach analysis. The correct approach involves systematically navigating the ICD-10-CM codebook, starting with the alphabetic index to identify the condition, then verifying the code in the tabular list. This process ensures that the coder considers all relevant coding guidelines and conventions, such as inclusion and exclusion terms, code first notes, and use additional code notes. This method aligns with the regulatory requirement to assign codes that accurately reflect the patient's diagnosis as documented by the physician, ensuring compliance with payers and public health reporting standards. Incorrect approaches analysis. An incorrect approach would be to rely solely on the alphabetic index without consulting the tabular list. This bypasses crucial information in the tabular list, such as specific subcategories, inclusion/exclusion terms, and instructional notes that modify code assignment. This failure to cross-reference violates the fundamental principle of accurate coding and can lead to the selection of an inappropriate code, potentially resulting in claim denials or incorrect data. Another incorrect approach is to select a code based on a general understanding of a disease category without reviewing the specific documentation for the patient's encounter. ICD-10-CM requires coding to the highest level of specificity documented. Guessing or assuming the diagnosis without direct physician documentation is a significant ethical and regulatory breach, as it compromises the integrity of the medical record and billing process. A third incorrect approach is to assign a code from a different chapter of the ICD-10-CM manual than where the primary condition is classified, perhaps due to a misunderstanding of the chapter's scope. For example, coding a complication of a disease under the chapter for the complication itself rather than under the chapter for the underlying disease, if guidelines dictate otherwise. This demonstrates a lack of understanding of the ICD-10-CM structure and can lead to misrepresentation of the patient's health status and the services provided. Professional reasoning. Professionals should approach ICD-10-CM coding by first thoroughly reviewing the medical record to understand the patient's condition and all documented diagnoses. They should then utilize the alphabetic index to locate potential codes, followed by a meticulous verification in the tabular list. During this verification, they must pay close attention to all instructional notes, inclusion and exclusion terms, and the ICD-10-CM official guidelines for coding and reporting. When in doubt, consulting with a supervisor or seeking clarification from authoritative coding resources is essential to ensure accurate and compliant code assignment. Question 5. The evaluation methodology shows a patient presenting with symptoms indicative of both a bacterial pneumonia and a concurrent viral upper respiratory infection. The physician's documentation clearly states the presence of both conditions and notes that the bacterial pneumonia is the primary reason for admission and treatment. The viral URI is documented as a coexisting condition. Which of the following coding approaches best reflects the accurate application of ICD-10-CM coding principles for this scenario? Option A. Assign a code for the bacterial pneumonia as the principal diagnosis, followed by a code for the viral upper respiratory infection, ensuring the bacterial pneumonia code is sequenced first as it is the primary reason for the encounter. Option B. Assign a code for the viral upper respiratory infection as the principal diagnosis, followed by a code for the bacterial pneumonia, as viral infections are often considered more complex. Option C. Assign a single code that encompasses both bacterial pneumonia and a viral upper respiratory infection, if such a combination code exists and is appropriate for the documented conditions. Option D. Assign separate codes for the bacterial pneumonia and the viral upper respiratory infection, without specific regard to sequencing or the primary reason for admission, as both are documented. The correct answer is A. Assign a code for the bacterial pneumonia as the principal diagnosis, followed by a code for the viral upper respiratory infection, ensuring the bacterial pneumonia code is sequenced first as it is the primary reason for the encounter. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, accurately assigning ICD-10-CM codes when a patient has multiple related infectious conditions. The professional coder must navigate the hierarchical structure of the ICD-10-CM coding system, understand the relationship between different infections, and apply coding guidelines to ensure the most specific and accurate representation of the patient's diagnosis. Failure to do so can lead to inaccurate billing, improper reimbursement, and potentially flawed statistical data for public health monitoring. Correct approach analysis. The correct approach involves identifying the primary infectious disease and then coding any secondary or related infections based on their specific manifestation and relationship to the primary condition, adhering strictly to ICD-10-CM official guidelines for coding and reporting. This aligns with the principle of coding for the condition chiefly responsible for the encounter, and ensuring all documented conditions that affect patient care are coded. For infectious and parasitic diseases, this often means looking for combination codes or sequencing codes to reflect the most significant diagnosis first, as per guideline instructions for specific disease categories. Incorrect approach is analysis. Coding only the most prevalent or easily identifiable infection without considering other documented conditions fails to capture the full clinical picture, violating the guideline to code all conditions that coexist at the time of the encounter and affect patient care. Assigning separate codes for each infection without assessing their relationship or hierarchy, when a combination code or a more specific sequencing is available, leads to overcoding and misrepresentation of the patient's condition. This can also violate guidelines that specify when to code manifestations of an underlying infection. Using a less specific code when a more specific code exists for a particular infectious agent or manifestation is a direct contravention of ICD-10-CM coding principles, which emphasize specificity for accurate data collection and reimbursement. Professional reasoning. Professionals should approach this by first thoroughly reviewing the entire medical record, including physician's notes, laboratory results, and diagnostic reports. They must then consult the ICD-10-CM alphabetic index and tabular list, paying close attention to inclusion/exclusion notes, code also notes, and code first notes. Crucially, they must apply the official ICD-10-CM guidelines for coding and reporting, particularly sections pertaining to infectious and parasitic diseases, to determine the correct sequencing and selection of codes. When in doubt, consulting with the healthcare provider for clarification on the relationship between diagnoses is a best practice. Question 6. Research into the upcoming transition to ICD-11 for a U.S.-based healthcare provider reveals significant structural and terminological changes compared to ICD-10-CM. A medical coder is tasked with ensuring all billing and record-keeping systems are prepared for accurate coding under the new system. Which of the following actions best demonstrates adherence to regulatory requirements and professional best practices for this transition? Option A. Continuing to use ICD-10-CM codes until official mandates for ICD-11 implementation are explicitly announced by the U.S. government, assuming minimal changes will affect current coding practices. Option B. Proactively reviewing and integrating the official ICD-11 implementation guidelines and training materials provided by the World Health Organization, WHO, and relevant U.S. regulatory bodies, ensuring all coding staff are trained on the new structure and terminology. Option C. Relying on the existing ICD-10-CM coding software to automatically convert codes to ICD-11, assuming the software vendor has incorporated all necessary updates without independent verification. Option D. Prioritizing the adoption of coding conventions observed in international medical journals that have begun publishing with ICD-11 without cross-referencing these with official U.S. implementation guidance. The correct answer is B. Proactively reviewing and integrating the official ICD-11 implementation guidelines and training materials provided by the World Health Organization, WHO, and relevant U.S. regulatory bodies, ensuring all coding staff are trained on the new structure and terminology. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding and billing, the need to stay current with evolving disease classification systems. The transition from ICD-10 to ICD-11, or the implementation of specific updates within either system, requires coders to adapt their knowledge and practices. The professional challenge lies in accurately identifying and applying the most current and appropriate codes, which directly impacts patient record accuracy, billing reimbursement, and statistical reporting. Failure to do so can lead to claim denials, financial penalties, and inaccurate public health data. Correct approach analysis. The correct approach involves proactively consulting official coding guidelines and updates released by the relevant regulatory bodies for the specified jurisdiction. In this case, implied to be the U.S. for ICD-10/11 exam context. This includes referencing resources like the Centers for Medicare and Medicaid Services, CMS, for ICD-10 updates and the World Health Organization, WHO, for ICD-11 guidance, as well as any specific implementation manuals or training materials provided for the exam. Adhering to these official sources ensures compliance with the regulatory framework governing medical coding and billing. This approach represents best professional practice because it guarantees the use of the most accurate, up-to-date, and legally compliant coding standards, thereby ensuring accurate reimbursement and reliable data. Incorrect approaches analysis. Relying solely on outdated coding manuals or software without verifying recent updates is a significant regulatory failure. This can lead to the use of obsolete codes, incorrect code assignments, and noncompliance with current coding standards. Such an approach risks claim rejections and potential audits. Assuming that the core principles of ICD-10 remain unchanged for ICD-11 without consulting specific ICD-11 documentation is another regulatory failure. ICD-11 introduces structural and conceptual changes that require dedicated study. This assumption can lead to misinterpretation and misapplication of new coding conventions, resulting in inaccurate coding. Using unofficial or anecdotal information from colleagues or online forums without cross-referencing with official guidelines is a professional and ethical failure. While peer discussion can be helpful, it is not a substitute for authoritative sources. This can lead to the propagation of misinformation and noncompliance. Professional reasoning. Professionals in medical coding and billing must adopt a continuous learning mindset. When faced with updates in disease classification, the decision-making process should involve 1. Identifying the relevant coding system and its current version. 2. Consulting official documentation and guidelines from the governing regulatory bodies, e.g., CMS, WHO. 3. Participating in accredited training or continuing education specifically addressing the updates. 4. Verifying coding software and resources are updated to reflect the latest guidelines. 5. Applying the updated codes with meticulous attention to detail, cross-referencing documentation as needed. This systematic approach ensures accuracy, compliance, and ethical practice. Question 7. Process analysis reveals that a coder is presented with a patient record detailing a complex neurological condition with associated psychological manifestations. The coder needs to assign the most accurate ICD-11 code. Which of the following approaches best reflects the structured methodology required for ICD-11 coding, considering its chapter organization and hierarchical nature? Option A. Prioritize coding based on the patient's age and gender, as these factors often dictate the primary chapter for common conditions. Option B. Assign a code based on the most prominent symptom described in the patient's record, regardless of the underlying diagnosed condition, to ensure the code is easily identifiable. Option C. Select a code from the symptoms, signs, or clinical findings not elsewhere classified, Chapter 24, if the condition involves multiple symptoms that do not fit neatly into a single, well-defined diagnostic chapter. Option D. Identify the primary neurological diagnosis, and then search for the most specific code within the diseases of the nervous system, Chapter 8. Cross-referencing with the mental, behavioral, and neurodevelopmental disorders, Chapter 6, for any overlapping or related symptoms that may require extension codes for further specificity. The correct answer is D. Identify the primary neurological diagnosis, and then search for the most specific code within the diseases of the nervous system, Chapter 8. Cross-referencing with the mental, behavioral, and neurodevelopmental disorders, Chapter 6, for any overlapping or related symptoms that may require extension codes for further specificity. Explanation. Scenario analysis. This scenario is professionally challenging because accurately classifying a patient's condition within the ICD-11 framework requires a nuanced understanding of its hierarchical structure and the specific coding conventions. Misinterpretation can lead to incorrect billing, inadequate data for public health reporting, and potentially impact patient care continuity if diagnostic information is flawed. The complexity arises from the transition from ICD-10 to ICD-11, which introduces new concepts and a more detailed, multi-axial coding system. Correct approach analysis. The correct approach involves a systematic review of the patient's medical record, identifying key diagnostic terms, and then navigating the ICD-11 browser or coding software to locate the most specific and appropriate code. This process must adhere to the ICD-11 coding guidelines, which emphasize using the most granular code available and understanding the relationships between different chapters and their subcategories. For example, understanding that mental, behavioral, and neurodevelopmental disorders, Chapter 6, might have specific manifestations that fall under symptoms, signs, or clinical findings not elsewhere classified. Chapter 24, if a definitive diagnosis within Chapter 6 cannot be established, demonstrates a deep understanding of the ICD-11 structure. This meticulous approach ensures compliance with coding standards and accurate representation of the patient's health status. Incorrect approach is analysis. One incorrect approach would be to select a code based solely on the primary symptom without considering the broader clinical picture or the specific chapter definitions within ICD-11. This fails to leverage the detailed structure of ICD-11, which aims for greater specificity. For instance, coding a general symptom of pain without exploring if it's a manifestation of a specific disease process outlined in another chapter, e.g., diseases of the musculoskeletal system and connective tissue, Chapter 10, would be a failure to apply the hierarchical nature of ICD-11. Another incorrect approach is to rely on outdated ICD-10 knowledge or generic coding principles without consulting the official ICD-11 guidelines. ICD-11 has significant structural and content differences from ICD-10, including the introduction of the foundation component and extension codes for enhanced detail. Ignoring these specific ICD-11 rules constitutes a regulatory failure, as it deviates from the mandated coding system. A third incorrect approach would be to choose a code from a chapter that is not the primary diagnostic category, simply because it appears more familiar or easier to locate. This violates the principle of coding to the highest degree of specificity and the intended organization of ICD-11, where conditions are grouped by etiology or body system. For example, coding a complication of a surgical procedure under a chapter for symptoms rather than under the relevant chapter for complications of surgical and medical care, not elsewhere classified. Chapter 22 would be a misapplication of the system. Professional reasoning. Professionals should approach ICD-11 coding by first thoroughly understanding the patient's diagnosis as documented by the clinician. They should then utilize the official ICD-11 browser or coding software, paying close attention to the chapter titles, block descriptions, and specific code definitions. When faced with ambiguity, consulting the ICD-11 implementation or coding guidelines is paramount. This systematic process, grounded in the specific structure and rules of ICD-11, ensures accurate and compliant coding, which is essential for effective healthcare data management and billing. Question 8. System analysis indicates that a medical billing specialist has received a claim for services rendered, but upon review, it is discovered that the patient's date of birth and insurance policy number are missing from the patient registration record. What is the most appropriate course of action to ensure compliance with billing regulations and facilitate timely reimbursement? Option A. Contact the patient or their representative immediately to obtain the missing demographic information before submitting the claim. Option B. Estimate the missing demographic information based on previous patient records to expedite submission. Option C. Hold the claim indefinitely until the patient voluntarily provides the missing information. Option D. Submit the claim with the incomplete demographic information, assuming the payer can identify the patient through other means. The correct answer is A. Contact the patient or their representative immediately to obtain the missing demographic information before submitting the claim. Explanation. Scenario analysis. This scenario presents a common challenge in medical billing, where a provider submits a claim with incomplete or inaccurate patient demographic information. The professional challenge lies in balancing the need for prompt claim submission to ensure timely reimbursement with the absolute necessity of accurate data to comply with payer requirements and prevent claim rejections or denials. Failure to address this can lead to significant financial delays and potential compliance issues. Correct approach analysis. The correct approach involves proactively identifying the missing demographic information and immediately contacting the patient or their representative to obtain the necessary details. This aligns with best professional practices as outlined by the Centers for Medicare and Medicaid Services, CMS, guidelines for accurate claim submission. Ensuring all required fields are complete and accurate before submitting the claim is paramount to avoid rejections and denials, thereby facilitating efficient revenue cycle management. This proactive measure demonstrates adherence to the principle of clean claims, which is a cornerstone of compliant and effective medical billing. Incorrect approach is analysis. One incorrect approach is to submit the claim with the incomplete demographic information, hoping it will be processed. This is a regulatory failure because it violates the requirement for accurate and complete information on all submitted claims, as mandated by payers, including Medicare and Medicaid. Such an action significantly increases the likelihood of claim denial, leading to rework, delayed payments, and potential penalties. Another incorrect approach is to discard the claim and wait for the patient to provide the information at a later, unspecified time. This is an ethical and professional failure. Ethically, providers have a responsibility to pursue payment for services rendered in a timely manner. Professionally, this passive approach leads to significant revenue cycle inefficiencies, impacts cash flow, and can create a negative patient experience if billing issues are not addressed promptly. It also fails to adhere to payer timelines for claim submission. A third incorrect approach is to guess or infer the missing demographic information. This is a severe regulatory and ethical failure. Guessing patient information is a direct violation of data privacy regulations, such as HIPAA in the U.S., and payer requirements for accurate identification. It can lead to misidentification of patients, incorrect billing, and potential fraud. This approach demonstrates a profound lack of due diligence and professional integrity. Professional reasoning. Professionals should employ a systematic approach to claim submission. This involves a pre-submission review of all claim components, including patient demographics, insurance information, and service codes. When discrepancies or missing information are identified, the immediate and correct course of action is to halt submission and initiate a process to obtain the accurate data. This process should involve clear communication channels with patients or their guarantors and internal protocols for tracking and resolving such issues. The decision-making process should prioritize accuracy and compliance over speed, recognizing that a clean claim, submitted correctly the first time, is far more efficient and cost-effective than a rejected claim requiring extensive rework. Adherence to payer guidelines and regulatory frameworks is non-negotiable. Question 9. Which approach would be most effective for a medical coder to ensure accurate and compliant billing when transitioning to a new ICD-11 coding tool with advanced functionalities? Option A. Focus only on the basic search features of the ICD-11 tool and disregard its advanced functionalities to maintain current productivity levels. Option B. Systematically explore and test the new ICD-11 coding tool's functionalities, pairing its outputs with established ICD-11 coding guidelines and payer requirements. Option C. Continue using familiar ICD-10 coding principles and search methods within the new ICD-11 tool, assuming minimal differences in application. Option D. Rely solely on the automated suggestions and search results provided by the new ICD-11 tool without independent verification against coding guidelines. The correct answer is B. Systematically explore and test the new ICD-11 coding tool's functionalities, comparing its outputs with established ICD-11 coding guidelines and payer requirements. Explanation. Scenario analysis. This scenario presents a professional challenge due to the introduction of a new ICD-11 coding tool. Coders must adapt to its functionalities, which may differ significantly from previous ICD-10 tools. The challenge lies in ensuring accurate and compliant coding while leveraging the new tool's capabilities effectively. Misinterpretation or underutilization of the tool can lead to coding errors, impacting patient records, billing accuracy, and regulatory compliance. The pressure to maintain productivity while learning new systems adds to the complexity. Correct approach analysis. The correct approach involves a systematic and thorough evaluation of the new ICD-11 coding tool's functionalities. This includes understanding its search algorithms, hierarchical structure, specific coding guidelines for ICD-11, which may differ from ICD-10, and any integrated decision support features. By actively exploring and testing these functionalities, coders can identify how they can be best utilized to improve coding accuracy and efficiency. This proactive learning aligns with the professional responsibility to stay current with coding standards and technologies, ensuring adherence to regulatory requirements for accurate medical record documentation and billing. This approach prioritizes understanding the tool's capabilities in relation to the specific demands of ICD-11 coding, thereby maximizing its benefits for compliant and efficient practice. Incorrect approaches analysis. One incorrect approach is to solely rely on prior ICD-10 coding knowledge and attempt to use the ICD-11 tool as a direct replacement without understanding its unique features. This fails to acknowledge the fundamental differences between ICD-10 and ICD-11, potentially leading to misapplication of codes and noncompliance with ICD-11 guidelines. It represents a failure to adapt to the new coding system and its associated tools, risking inaccurate data submission. Another incorrect approach is to only utilize the basic search functions of the ICD-11 tool and ignore its advanced features, such as semantic search, linkage functionalities, or specific modules for certain disease categories. This underutilizes the tool's potential, leading to less efficient coding and potentially overlooking more precise code assignments that the tool is designed to facilitate. This approach does not fully embrace the advancements offered by the new tool, potentially hindering optimal coding practice and compliance. A third incorrect approach is to assume the new tool automatically ensures compliance without verifying its output against established ICD-11 coding guidelines and payer-specific requirements. While new tools aim for accuracy, human oversight and validation remain critical. Relying solely on the tool without independent verification can lead to the propagation of errors if the tool has limitations or if the coder misunderstands its application. This bypasses essential quality control measures and regulatory adherence. Professional reasoning. Professionals should approach the implementation of new coding tools with a mindset of continuous learning and validation. The decision-making process should involve 1. Understanding the regulatory mandate for adopting the new coding system, ICD-11. 2. Proactively seeking training and resources specific to the new tool in ICD-11. 3. Systematically exploring and testing all functionalities of the tool, comparing its outputs with established guidelines. 4. Validating coding decisions against official ICD-11 coding instructions and payer policies. 5. Documenting any discrepancies or challenges encountered and seeking clarification from appropriate sources. This methodical approach ensures that the coder not only becomes proficient with the tool, but also maintains the highest standards of accuracy and compliance. Question 10. The review process indicates that a medical biller encountered the term acute exacerbation in a patient's progress note. The biller is unsure if this term requires a specific ICD-10 or ICD-11 code that denotes the worsening of a chronic condition, or if it can be coded based on the underlying chronic condition alone. Which of the following actions best reflects the appropriate professional approach to ensure accurate billing and coding? Option A. Code the term acute exacerbation using a general code for worsening condition if available in the coding manual without seeking further details. Option B. Assume acute exacerbation implies a worsening of a previously diagnosed chronic condition and assign a code for the chronic condition without further inquiry. Option C. Consult the rendering physician for clarification on the specific meaning and clinical significance of acute exacerbation in this patient's case and cross-reference with official ICD-10 PCS or ICD-11 coding guidelines. Option D. Rely on personal knowledge of common medical terms to interpret acute exacerbation and select the most likely corresponding code. The correct answer is C. Consult the rendering physician for clarification on the specific meaning and clinical significance of acute exacerbation in this patient's case and cross-reference with official ICD-10 PCS or ICD-11 coding guidelines. Explanation. The review process indicates a potential discrepancy in how a specific medical term was interpreted during the billing process. This scenario is professionally challenging because accurate medical billing hinges on precise understanding and application of medical terminology, directly impacting claim accuracy, reimbursement, and compliance with payer guidelines. Misinterpreting terminology can lead to incorrect coding, which in turn can result in claim denials, audits, and potential penalties. Careful judgment is required to ensure that the chosen terminology aligns with the documented clinical encounter and the established coding conventions. The correct approach represents best professional practice because it prioritizes accurate documentation and adherence to established coding standards. By seeking clarification from the provider and referencing authoritative coding resources, the biller ensures that the terminology used for billing is consistent with the patient's medical record and the official coding guidelines. This meticulous approach minimizes the risk of errors, supports accurate reimbursement, and upholds compliance with regulatory requirements for medical billing. An incorrect approach that relies solely on a common understanding of a term without verifying its specific medical context is professionally unacceptable. This failure to seek precise meaning can lead to the selection of an inappropriate ICD 10-CM or ICD 11 code, violating the principle of coding to the highest level of specificity supported by documentation. Another incorrect approach that involves guessing or assuming the meaning of a term without consulting the provider or official resources represents a significant ethical and regulatory failure. This practice directly contravenes the requirement for accurate and truthful representation of services rendered, potentially leading to fraudulent claims and noncompliance with payer policies and federal regulations. Professionals should employ a decision-making framework that begins with a thorough review of the medical documentation. If any ambiguity or uncertainty arises regarding medical terminology, the immediate next step should be to consult the rendering provider for clarification. Concurrently, referencing official coding manuals, ICD 10-CM/PCS or ICD 11, and payer-specific guidelines is crucial to ensure the correct application of terminology within the coding system. This systematic process of verification and consultation ensures accuracy, compliance, and ethical billing practices. Question 11. The analysis reveals that a patient presents for a routine follow-up appointment for their long-standing type 2 diabetes mellitus, which is managed with oral medication and regular blood glucose monitoring. The physician's documentation also notes the patient has a history of hypertension, currently controlled with daily medication, and mild osteoarthritis of the knees, for which the patient takes over-the-counter pain relievers as needed. The physician's assessment for this visit focuses on the diabetes management and does not explicitly mention treatment or further evaluation of the hypertension or osteoarthritis during this encounter. Which coding approach best adheres to the ICD 10-CM official guidelines for coding and reporting for this scenario? Option A. Code Type 2, diabetes mellitus, hypertension, and osteoarthritis of the knee, as all are chronic conditions that are monitored or managed. Option B. Code Type 2, diabetes mellitus and hypertension, as these are the conditions actively managed with prescription medication. Option C. Code Type 2, diabetes mellitus, hypertension, and osteoarthritis of the knee, but only if the physician explicitly states they are affecting the current encounter. Option D. Code only Type 2 diabetes mellitus, as it is the primary focus of the physician's assessment for this encounter. The correct answer is A. Code Type 2 diabetes mellitus, hypertension, and osteoarthritis of the knee, as all are chronic conditions that are monitored or managed. Explanation. Scenario analysis. This scenario is professionally challenging because accurately coding for patients with multiple chronic conditions and comorbidities requires a thorough understanding of how these conditions interact and impact the patient's overall health status. The coder must not only identify each individual condition, but also determine its significance in the context of the patient's care, as dictated by the ICD 10-CM official guidelines for coding and reporting. Failure to do so can lead to inaccurate reimbursement, misrepresentation of patient acuity, and potentially impact quality reporting metrics. Correct approach analysis. The correct approach involves identifying all documented chronic conditions and comorbidities that affect patient care, treatment, or management. This aligns with the ICD 10-CM official guidelines for coding and reporting, which emphasize coding all conditions that coexist at the time of the encounter and require or affect patient care. For chronic conditions, if they are still treated or monitored, they should be coded. This ensures that the patient's complete health picture is captured, leading to appropriate medical necessity justification, accurate risk adjustment, and proper resource allocation. Incorrect approach is analysis. One incorrect approach is to only code the primary diagnosis and ignore all other documented chronic conditions and comorbidities. This fails to meet the regulatory requirement to code all conditions that affect patient care. It misrepresents the patient's complexity and can lead to underpayment and inaccurate quality metrics. Another incorrect approach is to code only those chronic conditions that are actively being treated during the current encounter, while ignoring those that are managed or monitored. The ICD 10-CM guidelines specify that chronic conditions that are monitored or managed should also be coded, even if not actively treated during the specific encounter. This approach also leads to an incomplete representation of the patient's health status. A third incorrect approach is to code every single condition mentioned in the medical record, regardless of whether it affects the current encounter or requires management. This can lead to overcoding, inflating the patient's acuity beyond what is clinically supported, and may violate principles of accurate and ethical coding. Professional reasoning. Professionals should adopt a systematic approach. First, thoroughly review the entire medical record, including physician notes, consultation reports, and diagnostic results. Identify all documented chronic conditions and comorbidities. Then, apply the ICD 10-CM official guidelines for coding and reporting to determine which of these conditions meet the criteria for coding based on their impact on the current encounter, treatment, management, or monitoring. When in doubt, query the physician for clarification on the significance of a condition. This ensures compliance with coding regulations and accurately reflects the patient's clinical picture. Question 12. Stakeholder feedback indicates a medical coder has reviewed a patient's chart and noted a discrepancy between the physician's documented diagnosis and the observations recorded by the nursing staff regarding the patient's current condition. The physician's note lists a stable chronic condition, but the nurse's recent entry details acute symptoms that suggest a worsening or new issue. The coder is unsure how to proceed with assigning the appropriate ICD-10 codes for billing and record keeping. Which of the following represents the most appropriate course of action for the medical coder in this situation, adhering to U.S. healthcare regulations and coding best practices? Option A. Code the patient's condition based on the physician's original documentation, assuming the nurse's notes are supplementary and do not supersede the physician's diagnosis. Option B. Ignore the nurse's notes and proceed with coding only the physician's documented chronic condition, as the physician is the primary authority on diagnosis. Option C. Query the physician for clarification on the patient's current diagnosis and ensure the documentation accurately reflects the clinical picture before assigning codes. Option D. Assign ICD-10 codes based solely on the nurse's detailed observations, as they reflect the most recent clinical status. The correct answer is C. Query the physician for clarification on the patient's current diagnosis and ensure the documentation accurately reflects the clinical picture before assigning codes. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a coder to navigate conflicting information and make a judgment call that impacts patient care documentation and potentially reimbursement. The discrepancy between the physician's documentation and the patient's actual condition, as observed by the nurse, creates an ethical and regulatory dilemma. The coder must prioritize accurate representation of the patient's condition while adhering to coding guidelines, and the principle of documentation drives coding. Failure to address this discrepancy could lead to inaccurate medical records, improper treatment planning, and non-compliance with healthcare regulations. Correct approach analysis. The correct approach involves querying the physician for clarification. This aligns with best professional practice and regulatory expectations, particularly under frameworks like HIPAA in the U.S., which emphasizes the accuracy and completeness of patient health information. By seeking clarification, the coder ensures that the diagnosis code accurately reflects the patient's condition as documented by the physician, or prompts the physician to update their documentation to reflect the observed reality. This upholds the integrity of the medical record and ensures compliance with coding guidelines that require codes to be supported by physician documentation. It also demonstrates a commitment to patient safety by ensuring the medical record is an accurate representation of the patient's health status. Incorrect approaches analysis. One incorrect approach is to code based solely on the nurse's observation without physician confirmation. This violates the fundamental principle that physician documentation is the primary source for coding. It bypasses the physician's role in diagnosing and documenting the patient's condition, potentially leading to inaccurate coding and misrepresentation of the patient's medical history. This could also lead to issues with payer audits and compliance reviews, as the coding would not be supported by the authorized medical provider's notes. Another incorrect approach is to ignore the discrepancy in code based on the physician's initial, potentially outdated, documentation. This fails to address the updated clinical information provided by the nurse and does not ensure the code accurately reflects the patient's current condition. It also neglects the ethical responsibility to ensure the medical record is up to date and accurate, which is crucial for continuity of care and patient safety. This approach could also be seen as a failure to adhere to coding guidelines that encourage the capture of the most specific and accurate diagnosis. A third incorrect approach is to assume the nurse's observation is a definitive diagnosis and code accordingly without physician input. While nurses play a vital role in patient care, they are not typically the primary diagnosticians in the same way physicians are. Coding based on a nurse's observation without physician confirmation risks misinterpreting the clinical picture and assigning codes that are not officially recognized or supported by the physician's assessment. This can lead to coding errors and potential compliance issues. Professional reasoning. Professionals in medical coding and billing must adopt a systematic approach when encountering documentation discrepancies. This involves 1. Thoroughly reviewing all available documentation, including physician notes, nurses' notes, and any other relevant clinical data. 2. Identifying any inconsistencies or ambiguities. 3. Prioritizing the physician's documentation as the primary source for coding, but recognizing the importance of other clinical observations. 4. When discrepancies arise, initiating a query process to the physician for clarification or amendment of documentation. 5. Adhering strictly to official coding guidelines and regulatory requirements, e.g., ICD 10cm official guidelines for coding and reporting, HIPAA. 6. Maintaining clear and professional communication with healthcare providers. This structured approach ensures accuracy, compliance, and ethical practice. Question 13. The audit findings indicate a discrepancy in how a medical coder is approaching the use of diagnostic coding systems, leading to concerns about data accuracy and future system compatibility. The coder appears to be treating ICD-10 and ICD-11 as interchangeable, without a clear understanding of their distinct structures and the implications of ICD-11 development as the successor to ICD-10. Which of the following approaches best reflects a professional understanding of ICD-10 and ICD-11 in the context of evolving medical coding standards? Option A. Focusing solely on the detailed alphanumeric structure of ICD-10, as its complexity ensures a higher level of specificity that ICD-11, with its proposed different structure, may not be able to replicate. Option B. Applying ICD-11 codes whenever a condition is encountered, assuming that ICD-11 is a direct, one-to-one replacement for ICD-10 and that all healthcare providers have already adopted it. Option C. Continuing to exclusively use ICD-10 codes for all documentation, as it is the current standard, and any mention of ICD-11 is premature and irrelevant to current billing and reporting practices. Option D. Recognizing that ICD-11 is the next generation of diagnostic classification, designed to be more flexible and digitally friendly, and understanding that while ICD-10 is still in widespread use, preparation for the transition to ICD-11 is a critical aspect of maintaining coding system relevance and compliance. Correct answer is D. Recognizing that ICD-11 is the next generation of diagnostic classification, designed to be more flexible and digitally friendly, and understanding that while ICD-10 is still in widespread use, preparation for the transition to ICD-11 is a critical aspect of maintaining coding system relevance and compliance. Explanation. The audit findings indicate a potential misunderstanding of the fundamental differences and transitional implications between ICD-10 and ICD-11. This scenario is professionally challenging because accurate coding directly impacts patient care documentation, billing accuracy, and public health reporting. A coder must possess a nuanced understanding of both systems to ensure compliance and data integrity. The correct approach represents best professional practice, because it demonstrates a commitment to staying current with evolving coding standards and understanding the practical application of these standards in a real-world setting. Specifically, recognizing that ICD 11 is the successor to ICD 10 and understanding the implications of this transition for coding practices, data migration, and system updates is crucial. This proactive and informed stance ensures that coding remains accurate, compliant with current and future regulations, and supports the intended use of health data. An incorrect approach that focuses solely on ICD 10 without acknowledging the existence or impending implementation of ICD 11 represents a failure to adhere to the evolving regulatory landscape. This can lead to outdated coding practices, potential noncompliance with future mandates, and the generation of data that may not be compatible with newer health information systems. Ethically, it fails to uphold the professional responsibility to maintain up-to-date knowledge and skills. Another incorrect approach that attempts to apply ICD 11 concepts without a thorough understanding of its structure, coding conventions, and the specific implementation timeline within the relevant jurisdiction is also professionally unacceptable. This can result in miscoding, inaccurate data, and potential financial penalties or audit failures. It demonstrates a lack of due diligence and a superficial engagement with the new coding system. The professional reasoning process for similar situations should involve a continuous learning mindset. Coders must actively seek out information from official sources, e.g., WHO, national health agencies, regarding coding system updates. They should engage in training and professional development opportunities focused on both ICD 10 and ICD 11. When faced with a transition, it is essential to understand the official implementation timelines and guidelines for the specific jurisdiction. A systematic approach involves 1. Identifying the current coding system in use, 2. Researching the upcoming system and its key differences, 3. Understanding the transition plan and timeline for the specific healthcare setting, and 4. Seeking clarification or additional training as needed to ensure accurate and compliant application of the appropriate coding system. Question 14. During the evaluation of a patient's medical record and the corresponding insurance claim, a medical coder notices that a complex procedure code has been billed, but the physician's documentation only describes a simpler, less resource-intensive service. The documentation does not provide any justification for the higher-level code, nor does it mention any additional services that would support the billed code. The coder also observes that this pattern of billing for higher-level codes than documented appears to be recurring for this physician. Which of the following actions best represents the appropriate professional response to this situation? Option A. Discuss the discrepancies directly with the physician and ask them to provide additional documentation to support the billed code. Option B. Immediately report the findings to the organization's compliance officer and provide detailed documentation of the discrepancies. Option C. Ignore the discrepancies, assuming the physician has a valid reason not to fully document the services. Option D. Adjust the billed code to the simpler code that aligns with the physician's documentation without further action. The correct answer is B. Immediately report the findings to the organization's compliance officer and provide detailed documentation of the discrepancies. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a coder to identify potential fraud or abuse within billing practices, which can have significant legal and financial repercussions for the healthcare provider and the coder themselves. The challenge lies in distinguishing between genuine coding errors and intentional misrepresentation for financial gain, demanding a thorough understanding of coding guidelines, payer policies, and ethical obligations. The coder must act as a gatekeeper, upholding the integrity of the billing process. Correct approach analysis. The correct approach involves meticulously reviewing the patient's medical record against the submitted claim. This includes verifying that the documented services align with the codes billed, ensuring medical necessity is supported by the documentation, and confirming that the billing adheres to all relevant ICD 10-CM/PCS and CPT coding guidelines, as well as payer-specific policies. This thoroughness is crucial for compliance with regulations like the False Claims Act and the Anti-Kickback Statute, which prohibit fraudulent billing practices. By documenting findings and escalating concerns through appropriate channels, the coder upholds professional ethics and legal responsibilities. Incorrect approach is analysis. One incorrect approach is to ignore the discrepancies, assuming they are minor errors or not the coder's responsibility. This failure to investigate potential fraud or abuse violates professional ethical standards and could lead to complicity in illegal activities. It also neglects the coder's duty to ensure accurate billing, which is a cornerstone of healthcare finance and regulatory compliance. Such inaction can result in significant penalties for the provider and damage to the coder's reputation. Another incorrect approach is to immediately report the findings as definitive fraud without further investigation or consultation. While vigilance is important, jumping to conclusions without a comprehensive review can lead to false accusations, damaging professional relationships and potentially causing undue distress. Professionalism dictates a systematic approach to verification and escalation, allowing for due process and ensuring that all evidence is considered. A third incorrect approach is to alter the documentation or coding to match the billed services without a clear clinical basis. This constitutes falsification of records, a direct violation of healthcare regulations and ethical principles. It undermines the integrity of the medical record and the billing process, leading to severe legal consequences. Professional reasoning. Professionals should approach such situations with a systematic process. 1. Understand the documentation. Thoroughly review the patient's medical record to grasp the clinical context and services provided. 2. Compare documentation to claim. Meticulously cross-reference the documented services with the codes and charges submitted on the claim. 3. Identify discrepancies. Note any inconsistencies, such as services billed but not documented, or services documented but not billed, or codes that do not accurately reflect the documented service. 4. Research coding guidelines and payer policies. Consult ICD 10-CM/PCS, CPT, and relevant payer policies to determine the correct coding and billing practices for the identified services. 5. Assess medical necessity. Ensure that the documented services were medically necessary and supported by the patient's condition. 6. Document findings. Clearly and objectively document all discrepancies, the research conducted, and the rationale for any conclusions. 7. Escalate appropriately. Follow the established organizational protocol for reporting suspected fraud or abuse, which typically involves informing a supervisor, compliance officer, or designated department. 8. Maintain confidentiality. Handle all information with discretion and confidentiality. Question 15. The evaluation methodology shows that a medical coding and billing department has received an audit report highlighting several instances of inaccurate code assignment and improper claim submission. Considering the paramount importance of compliance within the U.S. regulatory framework for medical coding and billing, which of the following stakeholder perspectives best reflects the most appropriate and ethically sound approach to addressing these findings? Option A. Initiate a process to retroactively amend patient medical records to provide justification for the codes that were initially assigned, thereby validating the submitted claims and avoiding any appearance of error. Option B. Focus on immediately adjusting billing amounts to recoup any identified overpayments, as the primary goal is to mitigate financial losses and ensure the organization's financial stability, with a secondary consideration for the underlying coding accuracy. Option C. Address only the most significant discrepancies flagged in the audit report, assuming that minor errors are less critical and will not pose a substantial risk to the organization's compliance status. Option D. Prioritize a comprehensive review of all identified coding and billing discrepancies, comparing them against the official ICD-10 and ICD-11 coding conventions, relevant payer policies, and federal regulations to determine the precise nature and extent of non-compliance, followed by implementing targeted corrective actions and preventative training. The correct answer is D. Prioritize a comprehensive review of all identified coding and billing discrepancies, comparing them against the official ICD-10 and ICD-11 coding conventions, relevant payer policies, and federal regulations to determine the precise nature and extent of noncompliance, followed by implementing targeted corrective actions and preventative training. Explanation. The evaluation methodology shows that a medical coding and billing department is undergoing an audit. This scenario is professionally challenging because the audit's findings directly impact the financial health of the healthcare organization and the credibility of the coding and billing professionals. Ensuring absolute compliance with the ICD-10 and ICD-11 coding guidelines, as well as relevant billing regulations, is paramount to avoid financial penalties, reputational damage, and potential legal repercussions. The pressure to accurately reflect patient care while adhering to complex coding and billing rules requires meticulous attention to detail and a deep understanding of the regulatory landscape. The correct approach represents best professional practice because it prioritizes a thorough review of all identified discrepancies against the official ICD-10 and ICD-11 coding conventions and applicable payer policies. This systematic process ensures that any identified errors are understood in their full context, allowing for accurate correction and the implementation of preventative measures. This aligns with the ethical obligation of coders and billers to maintain the integrity of healthcare data and financial transactions, thereby upholding the principles of accuracy, honesty, and accountability mandated by professional coding bodies and regulatory agencies. An incorrect approach that focuses solely on correcting the immediate financial impact without understanding the root cause of the coding or billing errors is professionally unacceptable. This approach risks perpetuating systemic issues, leading to repeated errors and continued noncompliance. It fails to address the underlying training needs or process flaws, thereby violating the principle of diligent practice and potentially leading to further financial losses and regulatory scrutiny. Another incorrect approach that involves downplaying or ignoring audit findings due to time constraints or perceived minor nature of errors is also professionally unacceptable. This demonstrates a lack of commitment to compliance and can be interpreted as negligence. It disregards the potential for cumulative impact of seemingly small errors, which can escalate into significant compliance breaches. This approach undermines the trust placed in coding and billing professionals to maintain accurate records and adhere to all governing standards. Finally, an approach that involves altering documentation to justify previously submitted codes, rather than correcting the codes based on existing documentation, is a severe ethical and regulatory failure. This constitutes fraudulent activity, directly violating laws against healthcare fraud and abuse. It erodes the integrity of patient records and billing processes, leading to severe legal consequences for both the individuals involved and the healthcare organization. The professional decision-making process for similar situations should involve a commitment to continuous learning, a proactive approach to understanding regulatory updates, and a culture of open communication regarding coding and billing challenges. When faced with audit findings, professionals should 1. Understand the scope and purpose of the audit. 2. Review all findings meticulously, cross-referencing with official coding guidelines and payer policies. 3. Identify the root cause of any discrepancies. 4. Implement corrective actions, including re-education if necessary. 5. Document all actions taken and communicate findings and resolutions to relevant stakeholders. This structured approach ensures that compliance is not just a reactive measure, but an integral part of daily operations. Question 16. Stakeholder feedback indicates a pattern of increased scrutiny from the Office of Inspector General (OIG) regarding billing practices for certain complex diagnostic procedures. The OIG has released a special fraud alert highlighting potential areas of concern and has initiated targeted audits in the region. What is the most appropriate course of action for a medical coding and billing department to address this situation? Option A. Conduct a comprehensive internal audit of the highlighted procedures, review OIG guidance thoroughly, and implement necessary coding and billing process adjustments to ensure compliance. Option B. Assume the OIG's alert is a general warning and continue current billing practices unless directly notified of specific violations. Option C. Instruct coders to avoid billing the complex diagnostic procedures altogether until the OIG's audits are completed to prevent any potential issues. Option D. Focus solely on updating billing software to reflect the latest coding updates, without investigating the specific concerns raised by the OIG. The correct answer is A. Conduct a comprehensive internal audit of the highlighted procedures, review OIG guidance thoroughly, and implement necessary coding and billing process adjustments to ensure compliance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical coding and billing professional to navigate the complex landscape of regulatory compliance, specifically concerning potential fraud, waste, and abuse. The OIG's role in identifying and preventing such activities is paramount, and a coding professional's actions directly impact the organization's adherence to these regulations. Misinterpreting or ignoring OIG guidance can lead to significant financial penalties, reputational damage, and even legal repercussions for the healthcare provider. The challenge lies in balancing efficient billing practices with the stringent requirements of preventing improper payments. Correct approach analysis. The correct approach involves proactively seeking clarification and implementing corrective actions based on OIG guidance. This demonstrates a commitment to regulatory compliance and ethical billing practices. By engaging with the OIG's resources and adapting internal processes accordingly, the organization minimizes its risk of non-compliance. This approach aligns with the OIG's mission to protect Medicare and Medicaid programs from fraud, waste, and abuse, and it upholds the professional responsibility of coders to ensure accurate and compliant billing. Incorrect approaches analysis. One incorrect approach involves dismissing the OIG's findings as mere suggestions without proper investigation. This is a significant regulatory failure, as OIG reports are often based on extensive data analysis and audits, indicating potential systemic issues. Ignoring such findings can be interpreted as willful disregard for compliance, increasing the likelihood of future penalties. Another incorrect approach is to implement superficial changes without addressing the root cause of the identified issues. This is an ethical failure because it creates a false sense of compliance while leaving the organization vulnerable to continued improper billing. The OIG expects substantive corrective actions that prevent recurrence, not just cosmetic adjustments. A third incorrect approach is to focus solely on avoiding immediate penalties without considering the long-term implications for patient care and program integrity. This is a failure of professional judgment and ethical responsibility. The OIG's work is ultimately about safeguarding the integrity of healthcare programs for beneficiaries, and a coder's role extends beyond mere financial transactions to ensuring the quality and appropriateness of services billed. Professional reasoning. Professionals should adopt a proactive and investigative mindset when encountering OIG-related concerns. This involves 1. Thoroughly reviewing and understanding OIG guidance and reports relevant to their practice area. 2. Conducting internal audits and root cause analyses to identify specific areas of noncompliance. 3. Developing and implementing comprehensive corrective action plans that address identified issues. 4. Seeking expert advice when necessary, such as from compliance officers or legal counsel. 5. Fostering a culture of compliance within the organization, encouraging open communication about potential issues. Question 17. Regulatory review indicates that a medical coder is responsible for translating physician documentation into billable codes. A patient presents with symptoms of shortness of breath and chest pain. The physician's progress note documents suspected pneumonia and orders a chest X-ray. The X-ray report confirms pneumonia. In the context of ICD 10cm coding and billing, which of the following actions best demonstrates the coder's role in ensuring accurate billing and compliance? Option A. Assigning the ICD 10cm code for pneumonia based on the confirmed diagnosis from the chest X-ray report, ensuring it is supported by the physician's documentation of suspicion and subsequent confirmation. Option B. Assigning an ICD 10cm code for shortness of breath and chest pain, as these were the initial presenting symptoms documented by the physician. Option C. Assigning the ICD 10cm code for pneumonia based solely on the physician's initial suspicion of pneumonia, without waiting for the confirmation from the chest X-ray. Option D. Assigning a less specific ICD 10cm code for a respiratory condition, as the initial symptoms were vague and the diagnosis was not immediately definitive. The correct answer is A. Assigning the ICD 10cm code for pneumonia based on the confirmed diagnosis from the chest X-ray report, ensuring it is supported by the physician's documentation of suspicion and subsequent confirmation. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding and billing where a coder must interpret complex clinical documentation to accurately assign ICD 10cm codes that directly support the medical necessity and justify the services billed. The professional challenge lies in the potential for misinterpretation, leading to inaccurate billing, which can have significant financial and legal repercussions for the healthcare provider and potentially impact patient care if services are denied. The coder's judgment is critical in ensuring that the codes selected are not only compliant with ICD 10cm guidelines, but also reflect the physician's documented intent and the patient's actual condition and treatment. Correct approach analysis. The correct approach involves a thorough review of the entire medical record, including physician notes, diagnostic reports, and treatment plans, to identify all documented diagnoses and procedures. The coder must then apply ICD 10-CM coding conventions and guidelines to select the most specific and accurate codes that represent the patient's condition and the services rendered. This meticulous process ensures that the billing accurately reflects the care provided, supports medical necessity for reimbursement, and adheres to regulatory requirements such as those outlined by the Centers for Medicare and Medicaid Services, CMS, in the United States. This approach upholds ethical coding practices and minimizes the risk of claim denials or audits. Incorrect approach is analysis. One incorrect approach involves coding based solely on the chief complaint or the most prominent symptom, without considering the full clinical picture. This fails to capture the complete diagnosis and may lead to undercoding or misrepresenting the patient's condition, violating the principle of accurate representation of services. Another incorrect approach is to code based on assumptions or information not explicitly documented in the medical record. This is a direct violation of coding guidelines, which mandate that codes must be supported by physician documentation and can lead to fraudulent billing practices. A third incorrect approach is to select codes that are less specific than what is documented, perhaps to simplify the billing process or due to a lack of understanding of coding nuances. This not only fails to accurately reflect the patient's condition, but can also lead to reimbursement issues and non-compliance with payer policies that require the highest level of specificity. Professional reasoning. Professionals should approach this situation by prioritizing thoroughness and accuracy. The decision-making process begins with a comprehensive understanding of the patient's medical record. Coders must then consult official coding resources and guidelines to ensure correct code assignment. When ambiguity exists, seeking clarification from the physician or clinical documentation improvement, CDI specialist is paramount. This iterative process of review, coding, and clarification ensures compliance, supports accurate reimbursement, and maintains the integrity of the billing process. Question 18. Risk assessment procedures indicate that a medical coder needs to transmit a patient's billing statement, which contains protected health information, FI, to a third-party billing service. Which of the following actions best ensures compliance with HIPAA regulations? Option A. Ensuring the billing statement is transmitted using an encrypted method and that the third-party billing service has a signed business associate agreement in place. Option B. Sharing the patient's billing details with an external marketing firm that has not signed a business associate agreement. Option C. Providing the billing statement to the third-party billing service and assuming all their employees have the necessary authorization to view it. Option D. Transmitting the billing statement via standard email without any encryption. The correct answer is D. Transmitting the billing statement via standard email without any encryption. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical coder to balance the immediate need for accurate billing with the stringent requirements of HIPAA regarding the privacy and security of protected health information. 5. Misinterpreting or overlooking HIPAA provisions can lead to severe penalties, including fines and reputational damage, while overly cautious interpretation might delay necessary patient care or billing processes. The coder must exercise careful judgment to ensure compliance without compromising operational efficiency. Correct approach analysis. The correct approach involves a thorough understanding of HIPAA privacy rule and security rule, specifically how they apply to the transmission and storage of PHI during the billing process. This includes ensuring that all electronic transmissions are encrypted, that access to PHI is limited to authorized personnel on a need-to-know basis, and that appropriate business associate agreements, BA, are in place with any third-party vendors involved in billing or data processing. The focus is on proactive risk mitigation and adherence to established protocols for safeguarding PHI, which is the cornerstone of HIPAA compliance. Incorrect approach is analysis. One incorrect approach involves transmitting patient billing information without encryption. This directly violates the HIPAA security rule, which mandates technical safeguards to protect electronic PHI, EFI, from unauthorized access or disclosure. Transmitting unencrypted data creates a significant risk of interception and breaches, leading to potential civil and criminal penalties. Another incorrect approach is sharing patient billing details with an external marketing firm that does not have a BAA in place. This is a violation of the HIPAA privacy rule. The privacy rule strictly limits the use and disclosure of PHI for purposes other than treatment, payment, or healthcare operations, unless the individual has authorized it or a BAA is in effect with the entity receiving the information. A marketing firm is considered a business associate if they perform functions or activities on behalf of the covered entity that involve the use or disclosure of PHI. A third incorrect approach is assuming that all staff members have inherent access to all patient billing records. HIPAA privacy rule requires covered entities to implement policies and procedures to limit the use and disclosure of PHI to the minimum necessary to accomplish the intended purpose. This means access to PHI should be role-based and restricted to individuals who require it to perform their job duties, preventing unauthorized access and potential breaches. Professional reasoning. Professionals should approach situations involving PHI by first identifying all potential HIPAA-related risks. This involves understanding the specific data being handled, the methods of transmission and storage, and the parties involved. A systematic risk assessment should be conducted, followed by the implementation of appropriate safeguards as mandated by HIPAA. When in doubt, consulting with the organization's privacy officer or legal counsel is crucial. The decision-making process should prioritize patient privacy and data security, ensuring that all actions are compliant with federal regulations and ethical obligations. Question 19. Strategic planning requires a medical coder to accurately interpret physician documentation for a patient presenting with symptoms of excessive worry, restlessness, and difficulty sleeping. The physician's final assessment notes generalized anxiety disorder with associated insomnia. The coder must select the most appropriate ICD-10-CM codes to reflect this clinical presentation. Which of the following coding approaches best aligns with ICD-10-CM coding principles and guidelines for this scenario? Option A. Assign codes for generalized anxiety disorder and insomnia as documented. Option B. Assign only the code for insomnia as it is a significant symptom. Option C. Assign only the code for generalized anxiety disorder as it is the primary diagnosis. Option D. Assign a less specific code for anxiety, unspecified in insomnia. The correct answer is A. Assign codes for generalized anxiety disorder and insomnia as documented. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, accurately capturing the nuances of a patient's mental health presentation to ensure appropriate reimbursement and reflect the complexity of care. The challenge lies in selecting the most specific and accurate ICD-10-CM codes for a patient experiencing symptoms that overlap across multiple diagnostic categories, while also adhering to payer guidelines and the principle of coding to the highest degree of specificity. Misinterpretation or oversimplification can lead to undercoding, inaccurate quality reporting, and potential claim denials. Correct approach analysis. The correct approach involves a thorough review of the physician's documentation, identifying all documented signs, symptoms, and diagnoses. It then requires applying the ICD-10-CM official guidelines for coding and reporting, specifically focusing on chapters related to mental, behavioral, and neurodevelopmental disorders. Chapter 5. The principle of coding to the highest degree of specificity is paramount. If the documentation supports a definitive diagnosis, that diagnosis code should be used. If the documentation describes symptoms without a definitive diagnosis, the signs and symptoms should be coded. In this case, the physician's documentation clearly indicates a diagnosis of generalized anxiety disorder with associated insomnia. Therefore, coding both the definitive diagnosis of generalized anxiety disorder and the specific symptom of insomnia, as supported by the documentation and guidelines, represents best professional practice. This ensures accurate representation of the patient's condition and facilitates appropriate care management and billing. Incorrect approach is analysis. One incorrect approach would be to only code the insomnia. This fails to capture the primary underlying mental health diagnosis, which is generalized anxiety disorder. This is a failure to code to the highest degree of specificity and misrepresents the patient's overall condition, potentially impacting quality metrics and future treatment planning. It also violates the principle of coding all documented conditions that affect patient care. Another incorrect approach would be to code only the generalized anxiety disorder and ignore the insomnia. While the anxiety disorder is the primary diagnosis, insomnia is a significant and documented symptom that affects the patient's well-being and treatment. ICD-10-CM guidelines often direct coders to report both the underlying condition and significant associated symptoms when they are documented and impact patient care. Failing to code the insomnia means a part of the patient's clinical picture is not being captured. A third incorrect approach would be to assign a less specific code for anxiety, such as a code for anxiety, unspecified, if the documentation clearly supports generalized anxiety disorder. This is a direct violation of the principle of coding to the highest degree of specificity. It fails to provide the detailed information necessary for accurate statistical analysis, research, and appropriate clinical decision-making by other healthcare providers. Professional reasoning. Professionals should approach this situation by first meticulously reviewing the entire physician's note, looking for definitive diagnoses, stated symptoms, and any contributing factors. They must then consult the ICD-10-CM official guidelines for coding and reporting, paying close attention to chapter-specific guidelines and coding conventions. The decision-making process should prioritize accuracy and specificity, always aiming to reflect the complete clinical picture as documented. When faced with overlapping symptoms or multiple diagnoses, coders must determine the principal diagnosis and then identify all secondary diagnoses or significant symptoms that warrant separate coding, ensuring compliance with all applicable coding rules and payer policies. Question 20. Implementation of ICD-10-CM coding for a patient admitted for management of preeclampsia, a condition that developed during the current pregnancy, which is a direct complication of pre-existing chronic hypertension. According to the medical record, the preeclampsia is the primary reason for the admission and management. Which of the following coding approaches best adheres to the ICD-10-CM official guidelines for coding and reporting? Option A, code the preeclampsia as the principal diagnosis, followed by the code for chronic hypertension. Option B, code only the preeclampsia as it is the condition requiring current management. Option C, code the chronic hypertension as the principal diagnosis as it was the pre-existing condition. Option D, code the chronic hypertension as the principal diagnosis, followed by the code for preeclampsia. The correct answer is A. Code the preeclampsia as the principal diagnosis, followed by the code for chronic hypertension. Explanation. Scenario analysis. This scenario presents a common challenge in medical coding, where a patient has multiple, related conditions that require accurate and compliant coding to ensure proper reimbursement and reflect the patient's true clinical picture. The challenge lies in discerning the principal diagnosis and sequencing secondary diagnoses according to established coding guidelines, particularly when one condition is a direct consequence of another. Misinterpretation can lead to inaccurate billing, potential audits, and a failure to capture the full scope of patient care. Correct approach analysis. The correct approach involves a thorough review of the medical documentation to identify all documented diagnoses. The coder must then apply the ICD-10-CM official guidelines for coding and reporting to determine the principal diagnosis. In this case, the guideline for coding complications of pregnancy and childbirth, specifically those arising from a pre-existing condition, dictates that the complication is sequenced first if it is the condition chiefly responsible for the admission. The subsequent coding of the pre-existing condition as a secondary diagnosis is then appropriate, reflecting the causal relationship. This adherence to official guidelines ensures regulatory compliance, accurate data collection for public health, and appropriate reimbursement. Incorrect approaches analysis. One incorrect approach would be to code the pre-existing condition as the principal diagnosis simply because it was present prior to the pregnancy. This fails to acknowledge the specific guidelines for complications of pregnancy, which prioritize the condition that occasioned the admission. This is a regulatory failure, as it violates the ICD-10-CM official guidelines for coding and reporting. Another incorrect approach would be to code only the pre-existing condition and omit the complication. This is a significant ethical and regulatory failure, as it misrepresents the patient's condition, potentially leading to undertreatment or inadequate resource allocation, and violates the principle of complete and accurate coding. It also fails to comply with the requirement to code all conditions that affect patient care. A third incorrect approach would be to code both conditions, but in the incorrect sequence, listing the pre-existing condition first. This is a regulatory failure because it does not follow the established sequencing rules for complications of pregnancy, leading to inaccurate reporting and potentially incorrect reimbursement. Professional reasoning. Professionals should approach such scenarios by first thoroughly understanding the patient's medical record. They must then consult and meticulously apply the ICD 10-CM official guidelines for coding and reporting, paying close attention to sections pertaining to the specific circumstances, such as complications of pregnancy. When in doubt, seeking clarification from the healthcare provider is a crucial step to ensure accurate documentation and coding. This systematic process, grounded in regulatory adherence and clinical understanding, forms the basis of professional decision-making.